So I'm Deborah Stocken. I'm here, I'm really pleased to talk to you about the methodological expertise that we have in the Royal College of Surgeons of England Surgical Trial Centre, and to share with you the breadth of the portfolio of the work that we do and how we're engaged as a partner with the HealthTech Research Centre. So I'm Deborah Stocken, I'm an NIHR Research Professor in Statistics, so I am a methodologist, Professor of Clinical Trials Research at the Clinical Trials Research Unit based at the University of Leeds. So the Royal College of Surgeons Surgical Trial Centre is hosted in the CTRU. The CTRU is one of the largest trials units in the country. We currently have over 200 staff and we conduct our research over 5 very broad divisions. We have a really wide, we've been in place for about 30 years. And we have, you can understand on the back of that, a really wide portfolio of work, ranging from single centre studies to national trials, through to big, large international multi-centre pieces of work. And not all trials unit work in the early phase and late phase space. We work in the early phase space, and that links very much with our NIHR partners, with the BRC and the previous medtech cooperatives, and in the future the HealthTech Research Centre. We have an R, we're not just a CTU, we're a CTRU, and the R is really important to us. We have a dedicated methodology division, that's our newest division, and the aim of that division is to push forward the clinical trial innovation, not just in terms of the design of efficient trials, but the efficient delivery of trials as we move forward. So you can see here the interventions. Obviously I'm putting surgery first because that's what I work in, but we work in a range of interventions. Our annual income is over £12 million. We are one of 52, I think we're currently at 52 UK CRC registered units. We're one of 7 Cancer Research UK accredited units and one of 9 Royal College of Surgeons of England accredited units. So this is just our structure. As I said, we've got 5 research divisions. I've talked a little bit about methodology and how methodology cross-cuts across all of our research areas. We have 2 divisions in cancer research, looking at early phase and late phase cancer trials, complex interventions, and then the division that I lead, which is the SID division, so that's Surgical Interventions, Diagnostics and Devices, and it's in this division that we host the Royal College of Surgeons Surgical Trial Centre. I'm going to move over in front of the slide because I'm scared about falling off the stage. And as you would expect, we have methodological expertise in, as you would expect, trial management, data management, statistics and programming, but we also have really key expertise in mixed methods methodology, behavioural science. We've got a dedicated PPIE team who work very closely with the other PPI teams in our faculty and with the other NIHR infrastructures. And as you'd expect, that operational delivery around business management, quality assurance and information systems. And the methodology doesn't just run across the research divisions, it runs across these yellow squares and all of our core capabilities. So the role of the trials unit is simply the strategic expansion of research that's important to patients. What we bring as a trials unit is methodological expertise and leadership from development right the way through to dissemination of early phase and late phase projects. Academic partnership and leadership for the development of portfolios, and that also hinges on the development of grant applications. And support for the development of our future methodologists and our future clinical investigators, and that might be through mentorship programs, but also more formally through funded fellowships. So the SID division that I lead has been in place since 2018, we're one of the newer divisions, and it came on the back of 3 initiatives. The first initiatives being the Surgical Trial Centre initiative from the Royal College, which was instigated in 2018. And the aim of this initiative was to pull together the collaboration of surgeons and academics. And at the same time, the University of Leeds had applied and the trials unit supported applications to NIHR for the surgical medtech and the in vitro diagnostics that you've heard about today. So it made sense that we pulled together these areas of research and expertise together into a division, and that's how SID came along. And the wider trials unit support the wider research in the faculty supporting the BRC and the 6 themes that Philip talked to you about. Obviously, the SID division, my division, are supporting the surgical technologies, but those are the research divisions are also supporting the wider BRC research. And we do that by providing, and I just quote from the application, the underpinning capabilities in innovative and adaptive early phase trial methodology, biostatistics, and with our colleagues in the health economics unit, the health economic modelling. Our success hinges on the partnerships that we have. I'm not going to go through this busy slide, but to highlight that obviously surgeons, the surgical associations that they work with, and the surgical trainee networks that our teams work with are really important to us and lead those really important questions. Along with our patient groups through our PPI team and the PPI teams through the other NHR infrastructures, they help us develop those really important questions. And I think what's important today is to highlight also our industry partnerships and the experience that we have working with you through the previous MedTech cooperatives. Predominantly that's been our front door for collaboration with you, and we look forward to more collaborations and more partnerships as we move forward with the HRC. And our research success hinges on the methodology. As I've said, the methodology division is really important in our trials unit. This is also coming from our Department of Health and Social Care strategy, who was, and I just quote from them, the single most important way to improve healthcare is through increasing use of innovative research designs, and that's exactly what we're trying to do with the trials unit. So we're well positioned. I hope you can see that's a bit of an introduction to the Surgical Trials Centre and the Trials Unit generally. I hope you can see we're well positioned methodologically to be, partnering and collaborating with the HRC as we move forward. I just want to share with you some of our funded work. So we have funded diagnostic accuracy studies, and the experience that we have in these obviously lends itself very well to the early diagnosis theme that's been described today. We've got many trials that have been funded in surgical interventions, and again this aligns with the minimally invasive therapies theme of the HRC. And we've got studies funded in rehabilitation, which obviously aligns with the assisted healing. So you can see that we are bringing a wealth of experience that we've accrued over the past 30 years. So together with David Meads from the University Health Economics team, we lead the cross-cutting theme of timely clinical evaluation. What we bring to that theme is a knowledge of the research pathway from early phase through to late phase studies. We bring knowledge of what the funders want, what they expect in an application. We bring knowledge of the regulatory arena that we work in for some of these trials, and the sponsorship requirements and the contracting requirements that come with that. These are our values. I'm not going to go through them all, but these are our trials unit values. Essentially, we are a value-driven and public staff-focused organisation. And we do have a parallel session that we're hosting this afternoon and again tomorrow morning. So the team and I are around for the next 2 days. It'd be great to see you at one of these parallel sessions. Oh, my slide's gone off. I don't know if I can go back. That's it, good. We do have a webpage that you can find us on. I wanted to flag the YouTube video. It'd be great for you to go and see. It's literally a couple of minutes, but it'll give you a real sense of where we work and who we are and what our values stand for. And yes, I look forward to meeting more of you over the next couple of days. So thank you. Go for coffee.